Emily had a lot going for her. She was in college, making good grades, had a good job, and lots of friends. She was also addicted to heroin, and she was so concerned with getting high that she got sloppy, and she would take whatever anyone gave her as long as she got high. Someone gave her some drugs laced with fentanyl, and she almost died. She had a seizure and went unconscious. Someone had Narcan, though, and they were able to revive her. She was lucky. She is my sister. Harm reduction is a range of services that lessen the adverse consequences of drug use and protect public health. This can come in the form of needle exchange, medication reversal, and counseling. It is necessary in the fight against the war on drugs. As a society, we should embrace harm reduction to prevent overdoses, disease, and death. According to the Tulsa World, there were 100,000 overdoses last year. This is more than car crashes, guns, and the flu and pneumonia combined. According to the Oklahoma Department of Health, of every 100,000 citizens in Oklahoma, 1,820 have hepatitis C. This is the highest rate in the country. 6,180 people in Oklahoma have HIV. 15% of those contracted it through intravenous drug use. The Daily Oklahoman reporter, Mary Wingacher, states that 3,107 inmates have hepatitis C. Each inmate costs $29,000 to treat. That's a total of $91 million spent to treat all of those who are infected. She states, quote, "If the state would legalize syringe service programs, commonly known as needle exchanges, which can connect drug users to counseling and other services to help them quit, these numbers would go down drastically. If those affected were given the opportunity to use clean needles and not be penalized for their drug use, they could be rehabilitated." There are solutions for those who need harm reduction if we can look past the stigma and criminality of those who use drugs. I was able to speak with Hannah Fields, co-founder of Stop Harm on Tulsa Streets, a harms reduction organization here in Tulsa. She told me about the services that they provide, and they are Narcan, which is an opioid reversal drug. It's given in nasal inhalation or as an injection. It basically reverses the effect of opioids, and it basically wakes someone up as if from a sleep and they don't remember most of what happened. Second is needle exchanges. This is their most popular service. A person gives them a dirty needle and they get a clean one, and the dirty one is disposed of accordingly. Next is fentanyl testing strips. This tests heroin, meth, and pills for traces of fentanyl. Pipes, they give out crack and meth pipes as a deterrent to shooting up. And finally, they offer counseling, both substance abuse and mental health counseling. Their main demographic is white males between the ages of 18 to 70, 50% of whom are homeless. They face many obstacles, though. One is criminality for possession and use of syringes and pipes. It is a misdemeanor in Tulsa to possess a pipe or a syringe. However, effective November 1st, a bill passed by Governor Stitt allows for organizations like SHOTS to possess syringes and pipes for their purposes. Another obstacle is the funding. Needles cost 25 cents. Last year, they distributed 156,000 needles, which is $39,000. For an organization that relies solely on public grants and private funding, that can really add up. As well as the cost of needles, there's administrative cost and cost for their other services. The biggest obstacle, though, is the stigma. People think that giving drug users clean needles is enabling them to use drugs. or that having Narcan on hand allows people to use heroin without the real threat of an overdose. This is not the case. Hannah says that they're not preventing drug use, but providing a safe haven for people who are going to use the dirty needles otherwise. What can we do? Decriminalizing drug use and focusing on rehabilitating the addict is the ideal way to use. That's not something that will likely happen in Tulsa anytime soon, but it is an idea. We can fund organizations like SHOTS with taxpayer money, or allocating money from other organizations and putting it into organizations like SHOTS. We can do our part. We can carry on the message of SHOTS to those around us. We can also carry Narcan if we're going to be in situations where we may come in contact with people who might overdose. Anyone can have a dose of Narcan on them, and it's not you aren't required to have a prescription. You can get a free dose by contacting SHOTS, and they will deliver it to you, or you can go pick up an order of it. Anyone can have it. It's easy to use, and it's free, and you might save a life. And you can put the word out. You can tell people, hey, you can get clean needles, you can get Narcan, you can get condoms, you can get pipes, whatever you might need to help you be the best you can be, even if you're in the throes of addiction and drug use. It can affect anybody. Anybody can be affected by it. And Hannah finished our conversation with these words. People think that what we are doing is morally wrong, but we are just trying to keep people alive. People like Emily.